Good evening, everyone, and welcome to the next lecture in the History of Medicine lecture series presented by the Dr. M.V.L.Kothari Chair in Division of Medical Humanities here in St. G.S. Medical College and KM Hospital. I'm extremely glad to meet everyone again after this period of 1 week. I hope everyone's doing well. It's great to see all of you back on this online platform. It's in fact amusing to think that the Zoom meets were actually a sequel of the COVID-19 pandemic because although they're almost unheard of before the pandemic, they are now firmly entrenched. I'm sorry, I'd like to request everyone to please keep your speakers on mute and don't unmute yourselves during the duration of this lecture. Thank you. So as I was saying, it's quite interesting to think of the Zoom meetings as sequelae of the COVID-19 pandemic because although they were almost unheard of before the pandemic, they are now part of our daily lives. Indeed, as we go about living from day to day, it's quite easy to forget that we ourselves have lived through a pandemic, which will be looked upon later on in the future as a historic period. And just as this current pandemic has been marked by the heroic deeds of several individuals, plagues and epidemics of the past have also produced many great men and women whose actions have had a far-reaching influence on our lives. So join us today as we explore the work of Indian doctors in the colonial era who have shaped the city of Mumbai as we know it today through many epidemics and pandemics that have plagued the city. So before we begin, I'd like to introduce our speaker for the day, Dr. Mridula Ramanna. Dr. Ramanna completed her MA in Delhi and her PhD from Mumbai. She is a historian with 34 years of teaching experience, having been the former head of the Department of History at the South Indian Education Society's College of Arts, Science and Commerce in Mumbai. She has 62 publications to her credit, including articles in the Journal of the Royal Society of Medicine, the Indian Historical Review, and the National Medical Journal of India. Dr. Ramanna has presented papers at international conferences in Sri Lanka, South Africa, Australia, Canada, and the UK, and has given guest lectures at Yale University and the University of Illinois, among others. She has been a recipient of the Rockefeller Residency and has also received several grants from the Wellcome Trust, the Dorabji Tata Trust, and the Indian Council of Historical Research, to name a few. She is also a prolific author, having written extensively on healthcare in colonial India, her most recent work being Facets of Public Health in the Early 20th Century Bombay in 2020. We're very pleased to have you here with us today, Ms. Ramanna, and we're extremely looking forward to your lecture. Thank you.
Thank you. Thank you, Rahul. And can you hear me?
Yes, ma'am, you're audible.
Yeah. At the outset, I want to salute your profession. You know, the whole community of doctors, you have become our heroes in the past 2 years. The way you battled the pandemic, some of you have some have even had to succumb to the disease. But I mean, it was so gratifying to read about in the newspapers and to encounter doctors who had worked through those shifts, grueling shifts, including my nephew who is a doctor at St. John's in Bangalore. Anyway, having said that, I would also like to thank Dr. Sunil Pandya, who wrote to me to speak to these new professionals, and I wasn't sure how I would fit in, but I'm going to try and do my best. My work has been on Mumbai, as Rahul has pointed out, and I don't know whether any of you are aware, but Mumbai possesses a very rich archive at the Maharashtra State Archives and also at the Asiatic Society. So when I present my talk, I'll be talking about, for example, smallpox vaccination, and the audience would, I'm sure, be delighted to hear that there are annual vaccination reports available, detailing the number of vaccinations that were given and so on. Now, I begin my talk by sharing the screen. I hope I get this right. Yes. Is that coming on, Rahul?
Ma'am, your screen is not yet been
Yeah,
shared.
yeah.
Yes, ma'am, it's
Now,
shared.
now,
Yes, ma'am, it's
yeah.
shared.
Okay. Uh, my focus will be particularly on the early 20th century, by which time you had these Indian doctors, more of them uh, coming into the public sphere, and they were trained in Western. I'm only going to talk about those trained in Western medicine. Most of them at this point of time were graduates of Grant Medical College. And they were the vital intermediaries in cholera control, in the prevention of epidemics at pilgrim centers, and in the promotion of smallpox vaccination. I have listed the names of Ananta Chandroba Baudaji. Some of you would be aware that there is a road named after him in Matunga. Atmaram Pandurang, Shantaram Kantak, Sakaram Arjun. They promoted smallpox vaccination in the 19th century, and Ananta Chandroba, who was superintendent of vaccination, has left these reports in which he describes how he had to counter superstition and also fear of mothers who didn't want their little ones to be vaccinated. And so it is admirable that these doctors, battled on in the early years of when Western medicine had come into Mumbai. As you all are aware, 1845 is the date of JJ and GMC. And so these early graduates promoted smallpox vaccination, and they were very vital in cholera control. Now, why do I say they are vital? Because they were the ones who would discount anxieties, and they would speak the language of the people. So, that was a very important point. The members of the Bombay Medical Union, which was founded as early as 1883, were very powerful voices in Bombay's civic affairs, and they would dissect the reports of the health officer. You have N.N. Katrak and Thomas Blaney. This Thomas Blaney was actually an Irishman, but he was a very popular private practitioner. They indicted the health department before the onset of the plague epidemic of 1896, as did Akashio Vigas and Ismail Jan Mohammed. Vigas was the first to diagnose the bubonic plague, while Jan Mohammed diagnosed 2 cases of pneumonic plague. The doctors propagated the Hafkins prophylactic in local newspapers and various forums, answering queries and discounting anxieties. In fact, Dr. Sorabji in the first lecture mentioned the draconian measures that were used by the colonial authorities to combat the outbreak of plague in 1896. These were inspection, disinfection, segregation of families, removal from plague-stricken homes, and hospitalization. In fact, hospitalization was viewed with a lot of suspicion, and therefore, by the public, and therefore, you have this caste and community hospital set up. The first was set up by Bahadurji in Parel for Parsis. The Patare Prabhu community set up their fever hospital. There was a hospital for Jains. And then, of course, there was Nasarwanji Hormasji Choksi, who was the superintendent of Arthur Road Hospital. What's happening here? Can you, this is Hafkin. And this is his assistant. He was called Surveyor. And it's very interesting that Surveyor gave Hafkin the prophylactic with a dose which was actually 4 times stronger than what was later accepted as standard. So we have a number of names who were associated with the efforts to combat plague. And here is Choksi, who was in charge of what is today Kasturba Hospital. That was the Atta Road Hospital during the peak of the epidemic. Choksi actually has left a report of how he had to encounter so many difficulties because patients would be sent to Atta Road Hospital under compulsion when they were actually beyond help. They were and they would die. So that made the hospital even more unpopular. And he writes that he had to deal with pseudo specialists who pretended to know at the time forgot their regular avocations as tram conductors, railway guards, engineers, postal inspectors, and so on. Choksi pays tribute to his colleagues, one Pilgaonkar and Manik Tarkad. She was a woman doctor and she served with him during the plague. There was always the danger of exposure to the disease, and two of his colleagues, P.N. Dauda and Annie Walk, who was incidentally the first woman to graduate from GMC, she worked in Kama Hospital. She succumbed to the plague. Now, the plague prophylactic, which was developed by Hafkin, which Dr. Sorabji referred to that day in 1897, was endorsed by these doctors. And that is what is very important because that made it more acceptable. Here we have Balchandra Krishna Bhatwadekar. He was chairman of the standing committee of the BMC, and he wrote, the province of hygiene was not to cure, but to prevent disease. He was part of that movement, which I will refer to, which I call the promotion of sanitary consciousness. And Bhatwadekar was one of them. But what is important in this analysis is that the fact that this prophylactic was propagated by Indian doctors would have made it more acceptable. There are names like D.A. Tarkad in Vai and Vishram Gole in Pune and Barjorji Sorabsha in Bharuch. And last but not least, Dr. Rakhmabai. I'm sure some of you would have heard of her. She was a very interesting lady. She qualified for the MD in Brussels in 1894, later trained at the London School of Medicine for Women. And on her return to India, she worked at Kama Hospital as house surgeon and then at Surat and as chief doctor to the princely states of Saurashtra at Rajkot. She was awarded the Kaisar-e-Hind, a medal, for her work during the epidemic. She worked very hard during the epidemics, plague and influenza epidemics. There are many more details about Rakhmabai which are very interesting, but I will not, because I would like to cover other figures. Of course, there is Anandibai Joshi, whom everybody knows about. She completed her MD at Women's Medical College of Pennsylvania in 1886. She was appointed resident physician of the women's ward at Kolhapur, but before she could take charge, she passed away, unfortunately. Now, to come back to the story of the vaccination, it's interesting to see the nuances in the whole story. When an effort was made to forcibly segregate smallpox patients, in fact, it was doctor municipal councillors who protested and who warned the colonial authorities that they should not repeat what was done during the plague, because as was pointed out at that lecture too, the consequences of those draconian measures was even the assassination of the plague officer in Pune, and there was also the link to the national movement. Now, what were the issues that these doctors took up? You know, apart from their role in the epidemics, they raised issues which were very vital to them and to their positions in society and as doctors. We have here Bahadurji. He was, he was, as this is from the Hindi Punch of that period, because he passed away during the plague. But in his short life, he was a campaigner for medical reform. And for him, medical reform concerned questions of efficiency and economy, of the rights and privileges of the sons of the country, and of the advancement of medical and sanitary sciences, which advancements have come to be recognized as a means of civilization and material progress of a country. The objectives of the campaign were the separation of the civil from the military medical service, the formation of one military medical service with European and Indian army branches, the reorganization of the civil medical service as an independent service, and improvement in the status of assistant surgeons and hospital assistants. These were posts which were manned by men, Indian men, and the salary paid to the subordinate medical service was the same as that of a cook advertised in the times of the colonials. Most of them belonged to the Indian medical service. They were paid 2,500 rupees per month in the 1890s. While these assistant surgeons, who were the backbone of the system, received only 100 to 200 rupees per month. So Bahadurji protested against the monopoly of the IMS. This was one thing which he campaigned for, and that is the opening of posts to Indian medical practitioners. Excuse me. He said to those who argued that government has the right to choose its own officers, he said all these colleges and hospitals were not beyond the concern of the taxpayer because medical facilities were funded by private philanthropy. As you know, many of the medical institutions in Mumbai city were funded by private philanthropy. And it's interesting that this campaign was taken up by the local press, Gujarati, Native Opinion, Maratha, Bombay Samachar, and so on, and in the Indian National Congress, in their sessions at Lahore, at Madras, at Pune, and even by the Bombay Presidency Association. Public meetings were held in Bombay, Calcutta, Madras to support this cause. Then Bahadurji went to London and campaigned there. The Times and the Daily Chronicle in England commented favorably. But the BMJ, we are all familiar with it, the IMS lobby saw to it that his views were not published in the BMJ. Bahadurji yet went to Carlisle, where at a meeting of the British Medical Association, he moved a resolution that the civil medical department should cease to be a privilege of the IMS. But two retired IMS doctors, one McNamara and Sir Joseph Ewart, stalled the acceptance. Not only that, Kenneth MacLeod, in a letter to the BMJ, argued that no sane government would adopt Bahadurji's recommendations and that the Indians had not shown their fitness for the high positions that they aspired for. The issue remains unresolved at the time of Bahadurji's untimely demise in 1898. And this scan is an obituary of Bahadurji. But the fight went on, and N.H. Choksey, as founder editor of the Indian Medico-Chirurgical Review, the issues are available, strangely, on what is known as the South Asia Open Archives 1893 to 96. And in this journal, Choksi printed Bahadurji's talk on medical reform and so on. So even after Bahadurji passed away, they carried on the campaign, other doctors. Bahadurji was actually highly qualified. He was the first Indian to obtain an MD from the University of London, but he was denied the post of Professor of Medicine at GMC. Instead, an IMS officer holding the LRCP diploma was appointed. So the campaign continued against this IMS monopoly. Bhatwadekar never lost an opportunity for protesting vigorously against what were called the jobberies perpetrated by the government of Bombay in the selection of professorships at GMC. So this campaign continues, and I will refer to it later. But what is very interesting has been what I call the altruistic alliances of public-private partnership in the promotion of healthcare. You have, in the early 1900s, physicians, philanthropists, and civic leaders initiating voluntary semi-official organizations providing healthcare and the promotion of preventive measures. Now, these are the organizations which were set up, as you can see on the slide. Bombay Sanitary Association. The Bombay Sanitary Association's objective was to disseminate knowledge about disease and measures to prevent them. And, also to promote concepts of hygiene and sanitation. The Anti-Tuberculosis League is actually very interesting because I think it's one of the first in the country which was set up, and it recognized that tuberculosis is a public health challenge. It is not as dramatic as the killer cholera or smallpox, but a silent killer. So the Bhatwadekar at the inaugural, all these doctors spoke at the inaugural of these organizations, and they were involved with it. And that is what I found very unique, because associated with them were philanthropists. Leading the philanthropist was Sir Ratan Tata. So you have the Anti-Tuberculosis League at its inaugural, here in Bhatwadekar, who assured the support of the non-official. When I say semi-official and non-official receives no government grant. Semi-official received grants from both GMC, BMC and the government of Bombay. Some grants from them and some from philanthropists. So Bhatwadekar was associated with what is known as the Social Service League. It still exists in Parel. And this league was organized in 1911 by reformers, and he ascribed the disease to overcrowding, insufficient ventilation, insanitary conditions, and unwholesome food. Of great interest to me as a woman is Kashibai Naurange. She was a medical professional, and she spoke at the meeting, at the inaugural of the Anti-Tuberculosis League. She pointed out that tuberculosis was wreaking havoc among the poorer classes, and that especially women who had to spend a lot of time in seclusion. And she also pointed out that the subject was vitally connected with hygiene, and therefore it was necessary to educate the masses. That was her argument. Lady Willingdon's scheme, which provided maternal and infant care, and the League for Combating Venereal Diseases. Here I would just like to also mention that in these years, the Bombay Medical Congress was held in 1909, and some of these Indian doctors read papers at the Congress. Of course, the importance was given only to the big figures from the colonial establishment. But yet, you have Choksi, who reported the results of the serum treatment which he had tried in plague cases. Bhatwadekar endorsed the efficacy of this serum treatment. Then you have Kawasji Dadachandji, who was president of the Bombay Medical Union. He emphasized in his paper the importance of pure water, since both cholera and typhoid were waterborne diseases. Then you have a very interesting paper called Unhygienic Bombay. This was written by two doctors, Jahangir Karsetji and Bommanji Master. They said the reason we are giving this title is because there is inadequate water supply, overcrowding, incomplete and imperfect sewerage system, pollution of the soil, improper location of cattle stables, and what they called the peculiar customs of and prejudices of the people. It's a very interesting account. And yes, now, apart from this, the doctors were also involved in this anti-malaria campaign. The first 20 years of the 20th century saw this anti-malaria campaign to some extent achieving success in Bombay. And here again, I found the role of these doctors countering superstition, because one of the recommendations was that wells and cisterns should be closed. But this was objected to by the Parsi community because well water, when exposed to the sun, was necessary for their rituals. The stocking of wells with fish were also objected to by the Jains. So you have these doctors playing the role of, popularizing these measures and explaining why these measures had to be undertaken. There is one K.B. Shroff. He referred to the beliefs about the presence of saintly beings in wells as sentimental objections. The doctors would give public lectures to explain these measures. And interestingly, there was also the support of Jamshedji Jijiboy, the business magnate, who exhorted his co-religionists to cooperate. To oppose the closure of wells was as much against the spirit of religion as against the laws of health, he said. The great Firosha Mehta, he said that these objections are more due to an attachment to custom than to a proper appreciation of the spirit which runs through religion. Every day or so, every week or so, there would be a report in the new local newspapers like the Times of India, the Jame Jamshed, Bombay Gazette, Bombay Samachar, and so on, giving a list of wells which had larvae in them, mosquito larvae. Anyway, it seems that the campaign worked, and what I found was that there was this close involvement of the medical community. The other area where doctors played a very vital role was in pilgrim centers, where regulations were imposed by the authorities because of the fear of cholera. So, again, in those 2 decades of the 20th century, I have found that there was the role played by doctors like Akashio da Gama, who was praised by the colonial authorities, by the sanitary commissioner for his efforts at Pandharpur. Then there is Anthony de Mello, who was deputy sanitary commissioner, who also is praised. And finally, by the mid-1920s, the BMJ stated that no fair or festival was responsible for epidemics in Bombay Presidency, and they attributed it to the efforts of Jamshid Munsif, who was acting director of public health. As you know, many of these posts were monopolized by the British, the IMS, but only after 1919 you find a few posts open, but they would always be acting, which is, like a temporary thing. Now, I would like to. This is Sir Ratan Tata. I call him the philanthropist extraordinaire because he is the one who initiated the idea of the Anti-Tuberculosis League and provided the funds. Here is the health officer who was another of this trio. I call actually four of them: Choksey, Batwadekar, John Andrew Turner, Sir Ratan Tata, and also Firozshah Mehta. Now, this man was quite an enthusiast, and he was for two decades health officer or attached to the municipal corporation, and he was a favorite of the Hindi Punch. You find many cartoons of him drawn in this paper, showing him as a piper chasing rats and swatting mosquitoes. Then there is, of course, Firozshah Mehta. Now, yes, as you all know, there has been a lot of focus on the influenza epidemic of 1918. And as far as Bombay was concerned, the issue was that many doctors were away on war duty. So the British, as usual, put up their hands and said they didn't know what to do and they didn't know where it came from. And there's a lot of correspondence blaming each other as to how it came into Bombay. Nevertheless, the work of relief was provided by volunteers and the medical subcommittee of the BMC. This included prominent doctors of the city: Batwadekar, Dada Chandji, G.V. Deshmukh, Erulkar, Nagutai Joshi, whom I will talk about, Kashibai Naurange, D.S. Sardesai, Chandulal Desai, and so on. And the report of the Influenza Epidemic Relief Committee mentions the work of the volunteers. It's a lot of volunteers came forward, associations came forward, including caste, community, professional associations, and provided relief. Not that it is, in fact, Choksey commented on the pandemic and he said, influenza reached a virulence before which even plague, with all its horrors, fades into insignificance. In the recent years, especially after this pandemic, there's been a lot of focus on the influenza epidemic and how acute it was. Anyway, here again, I find that the presence of Indian medics was very vital, particularly because many of the doctors were away on war duty. Now, I would like to talk about, excuse me, Rahul, how much time do I have?
Ma'am, it's 20 minutes to 7, but please take as much time as you need. No worries.
Thank you, Rahul. It's very gratifying. I would like to talk about another major public health challenge, which I may not have enough time to cover, but that was infant and maternal mortality. This was a concern for the colonial authorities in a way, but what one finds, especially in these 2 decades, is the emergence of women doctors. The first batches came out in the late 19th century, and by this time, by the time of the first 2 decades, you have more and more women. Now here is Rani Rajwade. She became Rani Rajwade after she married Rajwade of Gwalior, Nagutai Joshi. She did her LM, LRC, PMRCS, and on her return to Bombay in 1912, she practiced medicine for 14 years, set up her own consulting rooms, nursing home, operating theatre, and so on. And later, she was organizing secretary of the AIWC and chairperson. And she was also chairperson of the subcommittee on women's welfare under the National Planning Committee. Sorry. With regard to women's health, there is, in fact, it requires a whole lecture, but I'm just going to say that women doctors, when they qualified, found a place because female patients preferred women doctors and Indian women doctors at that. And I will show you other figures who played a role in these years. There is Dosibai Dadobai, who was the first Indian woman to complete her MD in tropical medicine at the London School of Medicine for Women. She was the first Indian woman fellow of Bombay University. She opened a maternity clinic and she was honorary obstetric consultant at Kama Hospital and at KEM. She was the first to use radium in cancer cases among women. And she was involved with the Bombay Presidency Infant Welfare Society, the Red Cross. She was president of the Association of Medical Women in India, organized the blood transfusion service and blood bank, and she was later on the what is known as the Boer Committee, which looked into health. The other lady whom I would talk about is Jerusha Girard. I have a paper on her in the NMJI, National Medical Journal of India. It's a fascinating person. She did her MD in obstetrics and gynecology from the London School of Medicine for Women. You know, when she tried to go to England, she found that the scholarships were not open. And again, the House of Tatas gave her a loan, and she went, and finally the government gave her a scholarship. And she served, when she came back from England, she served at Lady Hardinge in Delhi and as senior surgeon in the Bangalore Maternity Hospital. Then she returned to Bombay and started private practice. She worked as honorary surgeon at Kama Hospital, and she is the first Indian to serve as medical officer at Kama Hospital from 1928 to 47. And it is under her guidance that the work of the hospital expanded, and you have undergraduate and postgraduate training facilities for women medical students provided there. She was a fellow and member of the Syndicate Bombay University, and she served as president of the Association of Medical Women in India. This Association of Medical Women in India was founded in 1907. And in the early years, it was again a monopoly of British women doctors. But later you have people like Dadabai and Jerusha Girard serving on as presidents and so on. And after independence, Jerusha Girard was chairperson, Maternity and Child Welfare Advisory Committee, ICMR, and she was awarded both the MBE and Padma Shri. Yes. Now, before I come to these other ladies whom I have put on this slide, I would like to just make a few comments on women and the doctors and the challenges that they faced. Ratmabai, for example, writes that she had to demonstrate the safety of delivery by delivering a pregnant sheep to show the safety of procedure, because she is operating in Surat and then in Rajkot and these places where she says that the women were not willing to come to her for delivery. But you find that all these doctors are very concerned about maternal mortality, and infant mortality, and they have presented papers at conferences, which I have seen and referred to, and they have suggestions to make, which are interesting. Dadabois, in one of her papers, says 70% of infant deaths are preventable with proper infant feeding, promotion of breastfeeding, and the training of dais. Now, the dai was very powerful. And one of the women doctors, I think it is Jerusha Girard, who writes that you have to, these dais have a hold on the mothers-in-law, and therefore you have to counter that. And Girard maintained that maternal mortality could be prevented, and it is ignorance and superstition. And she is concerned with the poor who live in congested dwellings. And she, in fact, did a survey in the 1930s, and she said many of them died of puerperal sepsis and anemia. Now, there is another doctor whom I have mentioned in this slide, Jairbanu Mistry. She suggested in a paper that she presented that we cannot antagonize the dai, but we can negotiate with them and we can train them. And as you will see from this slide, Jairbanu had a very interesting point to make to the Indian Prostitution Committee in 1923, where she gave a note of dissent along with 3 others against the recommendations for regulation and punishments for prostitution. She was chairperson parliamentary subcommittee of the Bombay Presidency Women's Council. She was also concerned with improving the standards of cinema films, and she worked to improve the condition of women in prisons, hospitals. It's so fascinating, these women had a variety of interests. However, I must say that women were, the space that was given to them was their forte was obstetrics and gynecology. They were not allowed generally to do general surgery. And the other interesting thing is women's health is a space which was left to women doctors. Here in India, the tension was between Indian women doctors and British women doctors. British women doctors who do not find a space in their own country would come here and try to monopolize the top position. So the tension really is between them. But as I had said earlier, female patients preferred Indian women doctors because of facility of language and so on. Now, the 1920s saw the National Medical College founded in fact, it was founded during the non-cooperation phase of the national movement. And the purpose was to impart to its students sound medical training of what they call the progressive Western medical science, and also to preserve the indigenous systems, to combine the best of the West with the East, to combine indigenous pharmacopoeia and to institute research into indigenous systems of medicine. This National Medical College was affiliated to the Bombay College of Physicians and Surgeons. I think their office was opposite KEM, if I'm not mistaken. And this National Medical College gave LCPS and MCPS degrees. And all these doctors whose names I have mentioned, like Vigas, Choksi, Batwadekar, D.A. Tarkad, and so on, they were all members of the first council. They received clinical training at Nair Hospital, which was founded in 1925. National Medical College and Nair Hospital, and there was also a Nair Dental College, Ophthalmic Hospital, and T.K. Gajjar's Chemical Laboratory. These were all, in the 1920s, they were established. Now, KEM, there is an interesting and excellent article on KEM by Dr. Sunit Pandya in the NMJI. And I will only briefly mention here that Dr. Atmaram Panduran, in fact, had advocated another medical college for Bombay City as early as 1885. And we already know that Bahadurji wanted a new medical college, and he wanted it to be staffed by Indians. And in a sense, KEM and JS Medical, they were recipients of Indian philanthropy established in 1926, staffed by Indians, equipment was locally made, and it was headed by Dr. Jivraj Mehta, who had just returned to India from London after obtaining his MD. He was approached by the Bombay Medical Union, and it was very vital that KEM should be located where it was, because that was the mill area. 80 mills were located there at that time. Briefly, I would like to mention Nauroz Wadia Maternity Hospital and the Bhai Wadia Hospital for Children. They were truly landmarks, and I found archival records showing that Sir Nasarwanji Wadia wanted to donate 8 lakhs of rupees to establish a maternity hospital. But the government of Bombay was not prepared to undertake fresh commitments, and they tried to divert the money to JJ. But Wadia refused. He wanted the hospital to be in the mill area. And in fact, before the hospital was built, there was a clinic run in a place called Supari Bagh, and you have Dr. Mangaldas Mehta, Dr. Patekar, Dr. Desai, and one sister Maggie, who is mentioned in the records, who ran this clinic. And then, of course, the hospital was established, and you have also, he raised a donation from 8 lakhs to 16 lakhs, and as we all know, it still functions. Now, I would like to briefly talk about the debates in the Bombay legislature. You know, after 1919, you have, under the 1919 Act, the ministers of these departments of medical and public health were transferred to ministers, and they were answerable to the provincial legislative assemblies. So you have in the Bombay legislature people like Dr. Gilder. Dr. Gilder was a member of the council for 10 years, and he raised many issues in the legislature. And very interestingly, he attended to Mahatma Gandhi at the Aga Khan Palace during his fast in 1944. Now, what were the issues that these doctors took up? IMS monopoly, which Bahadurji had started. In 1909, the Morley Minto reforms promised that a third of the appointments in the IMS would be filled by Indians. But the dispatch was one thing and the implementation was another. A local newspaper, Kaisar Hind, said, which was associated with Mehta, Firozshah Mehta, it is the permanent bureaucracy that has to put into execution his orders. And it is this evergreen and flourishing corporation of the white Brahmins, which is the real master of the situation. And even when the IMS Reorganization Committee was set up in 1919, there was only one Indian, and that was T.B. Nariman, who was on the committee. Now, as I said, medical and public health departments replaced the sanitary departments. But it's not that things became better in any way. In fact, when the Women's Medical Service was being thought of in 1914, Rani Rajwade made a representation and said, you should give preference to local women graduates, and it should not be just for Western women doctors. So this feeling that this monopoly should be broken up was continues. I mean, in 1928, Gilder pointed out in the legislature that IMS officers, why it was, the IMS officers were objecting to Indians being given positions. And they said, let them not think that they will get higher appointments. So Gilder remarked that the indigenous profession was perceived to be hewers of wood and drawers of water. And by this time, by the late 1920s, you had Indians coming back from Europe with advanced medical training, setting up lucrative private practice, which used to be a monopoly of the British and the IMS. So you can see in fact, Gilder gives the example of a European doctor, IMS. He was appointed as professor of midwifery, and he had an MBBS from London and a postgraduate qualification from Europe. So Gilder asks, in what way is he superior to a student who has studied at the local Motlibai hospital attached to JJ? This question was also taken up by the press, the Bombay Chronicle. It referred to the opening of 30 new commissions in the IMS only to Europeans. The Bombay Samachar asked why this was being done when the government says they want to reduce expenditure. It was obvious that these were berths for the British. And the British Medical Association, interestingly, puts pressure in England that these posts should be reserved for the IMS. It would be difficult to get members of the medical profession to go to India unless these posts were reserved. This was the point of the BMA. So you see these interesting, dimensions. And this was one issue which doctors took up. The second issue is the discriminatory allocation of grants. And, I want to go back. Discriminatory allocation of grants. Here again, Gilder gives an example of how 200 indoor patients were driven out of JJ Hospital in 1922 because the authorities didn't have the grants to look after them. And then 6 months later, nothing was done. Gilder showed in 1928 that the amount spent at St. George's Hospital, which today is a government hospital, was at that time for Europeans and Anglo-Indians. And he pointed out that this hospital gets a grant which is double that which is given to GT, Gokuldas Tejpal Hospital. At that point of time, St. George's had 5,443 patients, while GT Hospital had 17,708 patients. You also have others like Dr. Dikshit from Surat, who pointed out that the sanitary condition of the city with high mortality rates was a disgrace to the municipality and the government, who had not paid a farthing for the waterworks. So the point that I'm trying to make is that public health was a concern to these medical professionals, and when they were in the legislature, they raised these issues. Choksey, in fact, wrote an article in the Times of India in the 1920s when he said there should be a special sanitary, preventive and curative service. And Dadatanji, in fact, suggested a scheme, a comprehensive scheme for sanitary and medical relief. He raised the issue in the legislature in 1925. He said this kind of a service should be provided both for urban and rural areas, and that would reduce the mortality during epidemics. He tried to move this resolution for 4 years. And finally, the minister in charge was B.V. Jadhav, and he regretted that the government could do nothing. Now, why could the government do nothing? Even though public health was a was transferred to Indian ministers, finance remained in the hands of the British. So, financial stringency was the explanation given. It was also pointed out that the health conditions of Bombay were responsible. Now, this was one argument which was put forward not by a doctor but by a member of the legislature, that because so many laborers came to Bombay in search of work and they had to live in unhealthy and unfavorable conditions, when they went back, they spread disease in the rural areas. But this was no excuse, because as Major Bhatia, who was of the IMS and who was Dean of Grant Medical College, said in 1931 in the Bombay legislature, he said that medical, economic and social circumstances had concentrated medical efforts in the big cities to the detriment of small towns and villages. He called the rural areas the Cinderella of the administration. The other issue which doctors took up was the pay, high salaries paid to British officials, deputy directors of health, public health, assistant directors of public health, and so on. And then there are also some interesting comments that they make. One doctor pointed out that during an epidemic, the giving of plague inoculations was left to private practitioners because these officials didn't want to go into the slums. The other thing that they spoke about was the bureaucracy. The director of public health, his headquarters was in Pune, but he would be touring all over the presidency, which included Sindh at that time. And he would go there because he wants to collect his traveling allowance. So you have, comments like this as well in the legislative proceedings. There is another interesting comment. When there was an outbreak of an epidemic, the police patel would report to the Mamlatdar. Then the Mamlatdar would report to the collector. Then the collector would report to the assistant director of public health. Then he would give instructions to the sanitary inspectors, and by then the epidemic would have played havoc. So you have these kind of comments in the legislature made by doctor councillors. I'm giving this example to show their involvement in the whole discussion on public health. The other issue they took up, interestingly, was the paucity of Indian nurses and the discrimination against them. This was raised by Gilder. In fact, Kama Hospital had 46 nurses, of which 42 were Europeans and only 4 Indians. And Gilder again pointed out the example of how a sister in charge was given a job. She was an Anglo-Indian, relying on fully qualified Indian assistants. So he points out this kind of what one could call racial discrimination in the nursing profession. There is, of course, the very famous example of, there is an article actually which I have written on her, Temina Adranwala. She's a pioneer of nursing, but I won't go into that. I would like to finally talk about this fascinating character, Soki. Soki was the first Indian director of the Haffkine Institute. He was actually a doctor, but as you can see, he had an MA in economics from the University of Edinburgh. He was MBBS, MD, IMS, very brilliant biochemist, recipient of the Rockefeller Fellowship. He had trained at Harvard, Toronto, and Cambridge, and she was the chairman of the subcommittee on national health in the NPC, finally MP of the Rajya Sabha. Now, what is very interesting about him is he joined the Haffkine Institute in 1925, and he was the first Indian director from 32 to 49. Now, what I found in the Rockefeller archives was that one of the Rockefeller officials visited Haffkine Institute. He was taken around by Soki. But this gentleman, this American called Louis Wendell Hackett, he has written in his diary that Soki is so preoccupied with the social and political problems of India that it is difficult to hold him on a scientific plane. Because at that time was published Catherine Mayo's Mother India. I don't know if any of you have heard of it, but Mahatma Gandhi dismissed it as a drain inspector's report. And Soki was very angry about it. And Hackett, the American visiting official, says Soki is very anti-British and he wants absolute Indian independence. And this mental attitude on Soki's part may explain to some extent the damaging criticism of his work in British circles. Anyway, later, Soki was on the Scientific Advisory Board of IRFA, which is the predecessor to ICMR. And as I have shown on the slide, he was chairman of the Subcommittee on National Health in the NPC. Finally, I would just like to show you, these are all the doctors, scientists who were associated with the Haffkine Institute and who were, I'll just read out. Shantaram Kantak, who took part in experiments on variola and vaccinia. C.R. Avari, he was a member of the Plague Research Commission, whose report in 1908 established that plague spread among rats and from rat to man through the rat flea. The rat flea bit man only when deprived of the natural host, the rat. The infected rat fleas were carried on the clothing of persons or in goods coming from an infected area. And often the human agent may escape the infection. Bubonic plague was not infectious and hence isolation was not necessary, but the pneumonic variety was. And here I would just like to mention that when that plague scare occurred in 1994, there were journalists rushing to the archives to look at all these facts. Then you have D.A. Tarkar. He was the son of Atmaram Pandurang. He served as inspector of inoculation, and then he was assistant director of the Haffkine Institute. S.N. Gore, who devised a simple method for bacteriological examination of water for the detection of B. coli, dysentery bacilli, and cholera like Vibrio. And Soperkar, who carried out experiments to determine the effect of varying degrees of temperature upon nutritive quality of blood when added to a plain medium for the cultivation of hemophilic organisms. Finally, if I may, I want to just go back to one slide which I missed. How do I do this? Yes. Oh. Yes, I wanted to show this. These are the other ladies. Cecilia De Monte, who was connected with the Bombay Presidency Infant Welfare Society. Kashibai Naurange. I'll just share the screen. Can you see it? Oh, stopped. Okay. Anyway, it is... What is stopped? No. Yeah. Can you see it, Rahul?
No, ma'am. Right now, nothing is visible, ma'am.
Okay, doesn't matter. I'll just mention them because I have already spoken about many of them. Like Jairbanu Mistri, Kashibai Naurange, Krishnabai Kelavkar, and two sisters, Hazel Machado and Myrtle Machado. They worked during the the influenza epidemic, and they were also, one of them was connected with the League for Combating Venereal Diseases. So I will stop the share now, and I will thank you for inviting me, and I hope I have taken you back to the early years of the 20th century and the struggles and achievements of your fellow professionals. Thank you. Thank you, Rahul, for inviting me.
Thank you so much, ma'am. It was indeed a pleasure to hear from you and to hear your lecture today. It was extremely fascinating to see how so many Indian doctors in colonial era in the early 20th century had to face multiple obstacles, hurdles, and prejudices. And despite all of this, they were able to come together and work to create solutions to the problems which the public had, solutions which often the British weren't very concerned about. And they really laid the foundation for so many of the institutions we see today. It was extremely interesting to learn all of this. If anybody in the audience has any questions or comments, please leave them in the chat box so that we may address them. We already seem to have a few. We'll just be reading them out. Ma'am, Dr. Nilima Kadambi ma'am says it was wonderful to learn about the brave women doctors who were pioneers in the evolution of healthcare in India, the British and the Indian doctors. She also says that Halfkind Institute is an iconic and important institution, and it was good to learn more about its history. Ma'am, does anybody have any questions? Please put them in the chat box. We also have comments from multiple people. There's Rukaya, Dr. Akash, Dr. Mario Vasa, Gargi Goyal, Karan Code, Animesh Jain, who are all thanking you for the wonderful talk. Really enjoyed it. Ma'am, if I may, I actually had a question for you myself. What happened to the IMS after independence?
It was dissolved. Like the ICS. You have heard of the ICS, Indian
Yes.
Civil Service. IAS replaced ICS, so IMS was dissolved.
Ma'am, so was it replaced by any institution?
I don't know whether you have a medical service like the Indian Economic Service or the Indian Foreign Service. Dr. Pandya would know. Sunil Pandya would know whether there is a. Do you have an Indian medical service? I don't think so. So one of the comments asked me about this article. I can send it to her if she sends me her email ID.
Yes, ma'am. I'll pass it on, ma'am.
Yeah.
Ma'am, we also have a comment from Randall Sequeira who says that a follow-up committee to the IMS was a recommendation of the Bhore committee.
Yeah, Bhore committee.
So I think we'll conclude the meeting here. It was a pleasure having all of you here attending it. And I look forward. Oh, we have more comments here. Animesh Jain would like the article to be shared with everybody. So I'll be putting it up on the group as soon as I get a copy of it. We also have a comment from Dr. Sunil Pandya sir who says that he's afraid we do not have an Indian medical service. Had we such an institution, it would have done a lot of good to the country.
Yes,
Thank you,
I
sir.
agree with you. Thank you, doctor. Thank you, all you doctors. It's been great interacting with all of you. Thank you.
Ma'am, there's also a request for you from Mr. Randall Sequeira, who's asking if you could please share what other archival sources were used.
Sure. Can I speak now?
Yes, ma'am.
Yeah. Doctor, the Wellcome Institute for the History of Medicine has some material, but our own archives has, all the reports of hospitals and dispensaries, the reports of the sanitary commissioner, and very fascinatingly, reports of voluntary organizations which provided health care. These are all there at the archives, Maharashtra State Archives, located in Elphinstone College. But yes, the Wellcome Institute has, and so does the British Library. They have some of the India Office records which one could use for history of medicine. And yeah. And now I noticed, like the Indian Medico-Chirurgical Review, which I referred to, many of these have now been digitized. So research now is so much easier than when I did it. You didn't have to go plodding through the archives. You can sit at your desk and scroll down and you'll find a lot of stuff. I hope this will inspire some doctors to take up history of medicine. Dr. Pandya has been a pioneer in this field.
So yes, thank you everybody for attending, and I'd just like to remind everyone that next Saturday, that is to say on the 15th of October, we have a lecture by Dr. Sunil Pandya sir himself on the genesis of our institutions, so on the genesis of KM Hospital and other institutes in Mumbai. We look forward to seeing you there. Thank you so much. I'll be ending this meet right now.
Thank you, Rahul.
Thank you, ma'am.